Hi there, Dr. Andrea Schnowske from Health and Horsepower. Welcome to our channel. And today I want to talk about growing pains in kids, but also adults too. So there is some newer research that has been done that has shown that there are a couple different minerals that can be deficient that can lead to growing pains in kids. Now, typically, when it comes to growing pains in kids or muscle cramps in adults, a lot of times we have to look at activity levels, and we also have to look at age range. Typically in kids, as they're going through rapid growth stages, so usually around like 2 to 4 years of age, and then again between 8 to 12 years of age, it's very common for kids to have growing pains. Their bodies are growing very rapidly, their bones are lengthening, and a lot of times that can cause some pain for them. But like I said, there is some newer research that has suggested a couple different minerals that may be problems. So the number one thing I want to talk about is vitamin D. So vitamin D is a fat-soluble vitamin, sorry, I can't talk today, that our bodies are able to basically break down partially in the stomach for absorption, and then our bodies need proper cholesterol as well as sun exposure to convert that into an active form of vitamin D. So simply drinking vitamin D milk or taking a vitamin D supplement alone, a lot of times is not enough. If we have any issues where we're not getting enough healthy fats, if we're not taking that vitamin D with the healthy fat, or our body's struggling to break down fats, that can lead to vitamin D deficiency. Now, vitamin D is used not only to help with bone density, but it's also used in muscle balance. So a lot of times vitamin D deficiency has also been associated with scoliosis or curvatures of the spine, but we can also see muscle cramps, we can see muscle imbalances coming from that. And some of the neuro research has suggested that kids that are experiencing growing pains, about 25% of them actually have a vitamin D deficiency. So it's very important that your kids are getting a vitamin D, but we also need to make sure that their bodies are breaking it down properly. Now, I know that I have a lot of patients that struggle with vitamin D levels. They may have been given a prescription vitamin D from their doctor, which is a very high dosage that they only take maybe once or twice a week. However, that puts a lot of strain on the liver, and I am not a big fan of that, especially for kiddos. So what I typically recommend is a smaller dosage on a daily basis for about 6 weeks, and retesting to see that vitamin D is back in normal range. Now, vitamin D normal range is between 30 and 100. 30 is just enough to prevent rickets. So I usually like to aim for about 45. Anything higher than that, and we can start to see some cardiovascular issues. If you're breastfeeding or you're trying to pass through that vitamin D through breast milk, we do typically want to have our levels in the 60 to 70 range to make sure that that's passing through the breast milk. But for most people, I like to aim around 45 is kind of the goal that I like to aim for when it comes to vitamin D. So for kids, if they haven't had their vitamin D level tested, but they are having growing pains, I would recommend start supplementing with a high quality vitamin D that is readily absorbed. What I mean by that is vitamin D ideally should be in a liquid form, and we want to make sure there's a fatty acid like MCT, which is medium chain triglyceride oils, or an olive oil or a mineral oil in there so that it is fat soluble and it's absorbing right away. Another thing that's really important is to make sure we have a vitamin K in there as well. That vitamin K helps absorption and helps to get it into your cells. So I know we carry a product in our office by Aceva. It's called Active D. 1 drop carries 1,000 milligrams, and that has the vitamin K and MCTs in it. So typically what I recommend for kids that are 50 pounds or less, I recommend 2 drops, which is 2,000 international units per day. For adults that are trying to maintain their vitamin D level, I typically recommend anywhere from 2 to 5 drops, 2 if they're already at the 45. If they're just above 30, then I would recommend more like the 5 to make sure we're getting that up a little bit more. If you're deficient in vitamin D, for kiddos, I would recommend doubling that, so doing 4 drops for 6 weeks and then retesting to make sure that's a normal range. For an adult that's deficient, I recommend 10 drops a day for 6 weeks and retesting to make sure that's a normal range. But if you don't know and you haven't had your level tested, 2 for kids and 5 for adults is kind of a good idea, but if you haven't had it tested, it's a great idea to make sure you know where you're at and where you need to go from there. The other thing that's been found in the research that can also cause deficiencies and cause some issues with muscle cramps and especially growing pains in kids is magnesium. Magnesium is used in 300 different enzyme reactions in our body. It's used not only for brain function and digestion, it's used for hormone balance. It actually helps to increase density in our bones, and it's also used in immune function, and it's used in muscle function. So a lot of different things that magnesium does in our body. Magnesium is water soluble, so that means we need to make sure that we're getting plenty of water when we take it so that it can be absorbed easily. Typically with magnesium, if you're taking too much, it'll actually be flushed through. So a lot of times if you're taking magnesium, you're not sure if you've got the right dosage. If you notice that your bowel movements are a little bit looser, more of a soft serve, for lack of a better term, that typically means that you're getting enough and it's getting pushed out the other side. So typically that means we need smaller doses or we're taking too much in a day. I usually recommend for kids about 100 milligrams per day if they're under 50 pounds. If they're between 50 to 100, I would probably recommend like 150 to 200 for them on a daily basis. And I usually recommend splitting that in 2 doses. So doing like half of that in the morning, half at night. For adults, I usually recommend about 400 milligrams to start with. And then typically you need to calibrate or increase until you get the loose stool. So say 800 milligrams cause loose stool, 700 is your magic number. And that's what you want to maintain for at least a month to get your storage built back up of that magnesium. The other thing that's really important, which we're going to talk about next, is our electrolyte imbalance. So if we look at electrolytes in our bodies, so we have sodium, potassium, as well as your, I can't talk today, your potassium levels, but there's a lot of different minerals that we need to make sure are in balance. So your electrolytes help to make sure that your body is actually moving water into your muscles, so they're less likely to be cramping or overreacting or having tension in them. So if our electrolyte balance or our salt intake is off, that can cause issues where even if you're drinking plenty of water, it goes straight through you because there's no salt to let that water get into your cells. So typically I recommend that we want to make sure we're getting at least half of our body weight in ounces. So if you're 100 pounds, 50 ounces a day. We also need to make sure we're getting at least 1 electrolyte drink a day as well. So you can do things like over the counter like Gatorade or Powerade or things like that. I'm not a big fan of the sugar content in those, so you can actually make your own electrolyte drinks. Typically, you're going to use water as well as either a citrus juice like orange juice, lemon, or lime. Then you're going to put honey and some type of mineral salt like a Celtic sea salt or a pink Himalayan salt to make sure you're getting those minerals in. If you do have high blood pressure, I would definitely recommend the Celtic sea salt rather than the pink Himalayan. Just a note, those typically do not affect chloride or your sodium levels. Those actually affect more of your chloride levels. So if you are having some blood pressure issues and you're being told to avoid salt, those might be safer options for you. Another thing that you want to look into is also making sure that if you are having muscle cramps, if you are having growing pains for your kiddos, heat can also be really helpful. So you can use either a warm cloth or a heating pad, and you can also do some massage with some lotion. I know at my house, typically when we have muscle cramps or growing pains going on, we do a little bit more stretching. We will also do Epsom salt soaks, which will also give you some of that magnesium. And then we also do massage with lotion. And those help a lot. But one thing that I feel like is very overlooked with kids is chiropractic care. When it comes to the biomechanics of your body, so your feet and the arch of your feet supports your whole entire body weight. If that arch or the muscles and ligaments around our ankle are weak, that can start to cause that to tip or rotate. So every single time we take a step, that whole entire ankle and foot rotates. Our knee rotates in, our pelvis rotates, and we're going to start using and overworking those muscles, and we're going to be more likely to have muscle pain due to overuse. So when it comes to chiropractic care, I always recommend getting your spine and your joints of the lower legs checked, making sure that you have the heel in proper position, making sure that ankle is supporting properly, making sure the muscles are nice and strong and are able to work throughout the day. If they're not, a lot of times we can do a combination of chiropractic adjusting to realign the joints. Typically, I give home exercises to strengthen those muscles. And in some cases, a support, whether that is just a simple shoe insert or a prefabricated orthotic may be helpful. But for some people that have had long-term issues or have had an injury where we may have changed some of the dynamics and some of the anatomy with bone healing, we may actually need a custom fitted foot orthotic. So typically with custom fitted foot orthotics from your podiatrist or from those scanners that they use, a lot of times they're just looking at pressure points and where you're kind of getting pressure or kind of where that foot is collapsing. So I usually recommend when you are getting a custom fitted foot orthotic, you do not want pressure on the foot. You don't want to be standing on a scanner. You don't want to be standing in a foam, or a lot of times they'll do like strips and things like that. You want to be seated with weight off of your foot so that we are supporting that foot in the best position possible for you, because everybody's arch, everybody's foot is different. So I typically recommend getting adjusted, getting that fit without pressure on the joint so that that is custom fitted for you specifically when your foot is at its best, not when it's collapsed, because we don't want to support that. That's the opposite of what we want to do. So if you have any questions about growing pains or muscle cramps, and you would like to find out more about the biomechanic portion, you can definitely give our office a call, 309-689-6200, or you can also check out our website, freedompeoria.org. If you are having any questions or concerns, we also offer consultations by phone, and if you're wanting to know a little bit more about those minerals or how to get those tested, we also offer lab testing too, and those kits ship directly to you. So thanks for tuning in this week. Hopefully you learned something today, and like I said, if you or your children are dealing with growing pains or muscle cramps, hopefully you know what you know, your 5 different things. We need to make sure we're looking at vitamin D, we need to make sure we're looking at magnesium, electrolytes, we need to make sure we are using heat and massage, and stretching, and then also getting the biomechanics checked out. So have a great week. We'll see you next week on Health and Horsepower.